Hey all, my name is Joshua Adair and I am a social work major. And so I will be going over my interview that I had with a social caseworker that worked for an inpatient psychiatric hospital. So I met with the social worker on October 6th. Her name was Mary Ellen Turner, and she works for Highlands Behavioral Health, which is a branch of UHS. Um, First off, my interviewee, her name's Mary Ellen Turner. She's been a social caseworker at Highlands for about a year and 7 months, and this was actually her very first social work job. So prior to this, she had graduated with her master's in social work from Simmons University in Boston, Massachusetts. Um, and so this was actually her very first social work job, and she's planning to move on to a new hospital here soon because Highlands doesn't actually allow social workers to work there unlicensed. They have to obtain their license within the first 90 days, and she's still working on her hours. So, first off, what is Highlands? Highlands is a 86-bed freestanding psychiatric short-term facility. So you would go there for immediate acute psychiatric care needs. The facility is open 7 days a week, 24 hours per day in order to be admitted. You can walk in or you may be transferred from the emergency room of a hospital. And average length of stay is about 4 to 5 days. The intent of the care provided at Highlands is to assist in the psychiatric disorders in adults and adolescents, anywhere from the age of 11 and above. The social worker interviewed primarily works with adolescents. So, what is the culture, religion, and traditions of the population? So, Mary Ellen stated that the population she works with mainly is adolescents between the ages of 11 through 18. They're typically admitted to Highlands due to suicidal ideation, homicidal ideation, behavioral issues, depression, psychosis, and aggression. She said that there are many kids who are LGBT, and you will find that they have a higher rate of suicide. The majority of clients on the adolescent unit are Caucasian children who have endured trauma, and trauma can be defined differently for many people. It could be bullying, abuse, loss of a loved one, recent divorced parents, sex trafficking, and honestly just being part of the LGBT community. So, what are the services provided and how are these services relevant to social welfare? So, Mary Ellen states that Highlands Behavioral Health System helps to stabilize patients who have attempted suicide or have active thoughts of suicide. They stabilize patients who have behavioral issues or who have conduct disorder, bipolar disorder, borderline personality disorder, and Highlands also has a unit to help with stabilization for psychotic patients, but this is primarily just adults, as they don't necessarily have um, the staff or the resources to help with adolescents who are dealing with psychosis. Though they do see some of those cases. The main focus of staff at Highlands is to help figure out the best treatment plan for the patient outside of the hospital. So they basically just bring them in, stabilize them, and then come up with a treatment plan, whether it's the partial hospitalization program where they come for day treatment, you could say, or whether they're just seeing a therapist outside of there, and or if they need residential treatment for an extended period of time. So, what is the role of the social worker, human service worker in this field? Mary Ellen's role can change weekly or daily from what she said. She said her main role is to be on the adolescent inpatient unit, in which she will conduct a biopsychosocial assessment on the patients. She continues to assess daily the client's safety and treatment plans and adjust accordingly. She provides information on outside care, patient resources, like I said, whether that's residential, individual therapy, substance abuse treatment, dual diagnosis treatment, PHP, family therapy, and so on, so that the patient knows how to move forward in their treatment or to know what to expect next, as many of these adolescents do not have much control of their treatment. It's simply because they're minors. Most treatment plans are either conducted with the guardians, whether that be the parents or another family member that has guardianship over them, or if it's Denver Human Services, and it could even be court ordered if they're a ward of the state. Mary Ellen stated that the social worker has the responsibility to call schools for updates and make child abuse reports. She conducts family meetings to meet with the family to kind of plan what the discharge looks like. Say if an adolescent is dealing with suicidal thoughts or attempts, she would meet with the family to make sure that the house is safe for the child to go back home to make sure that there are no weapons out, whether that be guns or knives or possibly even rope laying around if they have a history of attempting to hang themselves. Mary Ellen stated that she also has run social work process groups for every unit in the hospital, including the adult unit and the high acute adult unit where the psychotic patients are. And this can be due to short staffing, in which social workers will float to other units and kind of fill in where they're needed. She's also provided care to patients who are participating in the partial hospitalization program, in which patients come to treatment for 8 to 12 hours per day, but they're still able to go home and stay at home and be with their families. And the role of the social caseworker is to make sure the client has resources outside of the hospital to help with their treatment and stability once discharged. And what education or credentials are needed to work with this organization? So I kind of already touched on that. A master's in social work is needed in order to work in a clinical role within the organization. But there are line staff who have direct patient care who don't even necessarily need a bachelor's. It's definitely preferred. But these are the staff that just kind of take patients to group therapy, and they transport them on and off the unit so that they can go get breakfast, or if they have a meeting with the doctor or the social worker. And then, so when Mary Ellen began her career at Highlands, she only needed her master's in social work. But like I said, now they're changing that rule to where you have to have your license within 90 days of being hired, which is why she's moving on to a new organization so she can finish getting her hours. And then, what are challenges the workers may face working within this organization? So, Mary Ellen expressed frustration with management not understanding the amount of work expected out of social workers, and that there's a huge lack of communication with management and staff, which is often caused by the constant transitioning of new directors of nursing, CEOs, unit managers, and clinical directors, etc. I just feel like despite the fact that many people go into psych, they have a lack of understanding of vicarious trauma, which is working with patients who have experienced trauma and basically taking on the emotional residue of exposure to that. And so with constant clinical directors transitioning in and out, you probably don't feel very supported there. And that's kind of what Mary Ellen was expressing to me. So, also, this can be a huge issue. Like, if a patient's care is determined by their insurance provider, like if their insurance runs out, then they basically kind of get the boot eventually. But as many of us know, due to the laws, like if somebody comes to the hospital and they're a present threat to themselves or to another person, then they have to be treated no matter what. So Mary Ellen said that we could see a lot of readmits due to this. Like if they don't get the care that they needed, and they have to leave because of insurance and it's not covering anymore, then they may just turn around and come right back a couple days later because they still need help and they still need treatment. But if they just walk in, then of course they can't be turned away. We have to treat them. So um, that can be one of the challenges, is that early discharge, lack of resources in general. So, what burnout prevention strategies are used by the workers in this organization? The social caseworker communicated that it has been really tough without a clinical director, with it constantly changing. She said that she's been through 3 clinical directors just in her short year and 7 months that she's been there. She said when there is a clinical director available, she gets supervision provided weekly, so she's able to meet with um, her director in order to talk through any issues that she's having. So that's helpful when it is an available tool. She states that she has also seen social workers switch roles to different units. Say if somebody's getting burnout with adolescents, they'll go work with the adults, or if somebody's getting burnout with the adults, they'll go to the high acute adults or the adolescents, or vice versa, and they just kind of switch around to kind of help one another out. Let's see, with numerous clinical directors filtering in and out, it can leave the social workers feeling unsupported and reaching burnout, which is why many of them will work together to fill in on different units for each other. But I mean, of course, that can only last so long. So, how is this program evaluated to ensure it provides the services needed by clients? So, Jill, the unit manager, she does monthly audits on patient charts. Jill is an evaluator at the hospital and is constantly evaluating programs within the hospital to ensure clients are meeting quality care. Highlands Behavioral Health is also a participant in the Joint Commission accreditation, which the Joint Commission accredits and certifies over 21,000 hospitals nationwide. Their accreditation is a symbol of quality and safety of an organization's commitment to certain procedural standards. What improvements could be made to this organization? So Mary Ellen stated that providing individual therapy while clients are in the hospital, kind of in order to start the process of treatment. If you study articles, it has been proven clients who are provided cognitive behavioral therapy while at inpatient hospitals have lower rates of returning. So NCBI provided a study on 300 patients whose primary diagnosis was depression, and and they were provided CBT for 6 weeks, but were also evaluated for change in just as short as 2 weeks. So Mary Ellen also suggested that Highlands could have more resources inside the hospital that include clinicians who are trained in helping with eating disorders, substance abuse, and trauma-informed care. These issues are often overlooked, or the lack of care or understanding is not provided to new staff when they're trained. So, like many of the line staff are responsible for documenting patients' behavior when it comes to meals or just their behavior in general, but there's just not typically enough follow-up whenever that information is provided um, to the nurses or to the therapist or the doctors, just because there's not enough flow kind of in the way that things move within the hospital, I guess. So I would say that this interview process was really informative and also challenging, because just seeing the amount of work that a social worker puts into the care of patients, and I don't know how it is in other hospitals, but Mary Ellen seems to carry a very large load, and with not much support. And you always hear that social workers are a very underpaid profession, so it can be pretty challenging and thought-provoking for what my future looks like as a social worker. But it was definitely interesting, and it doesn't change my mind one bit about what I want to do. Kind of just spurs me along even more. But this experience was great, and thank you.